More than 600,000 people in Wales have hearing and/or sight loss. This means that in any waiting room, 1 in 4 people are likely to have some form of sensory loss. Healthcare should be accessible to everyone. People with sensory loss have different communication and information needs that are not always met when they need healthcare.
When you're at home, you're suffering from severe sight loss, and you actually get a letter from the ophthalmology department, and it's in small print.
The All Wales Standards for Accessible Communication and Information for People with Sensory Loss were published in December 2013. These aim to ensure that adjustments are made so that patients with sensory loss are safe and well cared for.
In my GP surgery, the nurse has made little adjustments for me. So I noticed with other people, she will, when it's their turn for the appointment, she'll call them from down the corridor and then they go to the room. But with me, she'll come out to reception and she'll call me then, and then I can follow her then round to the consultation room. So that's an adjustment she's made after noticing that I do have sight loss. And it's a small adjustment, but it just makes it a lot easier for me.
Work taking place across NHS Wales is having a positive impact. We are training our staff to be sensory loss aware. We are using new technology to improve access to our services.
We worked with colleagues to come up with an action plan in terms of what we could put into place. Some of those things included giving patients who have a sensory loss alternative methods of communicating with us, for example. So we have social media feeds, but we also offer an email address if patients wish to email us because they can't use the phone. We've also put in place a system called My Health Online, which enables patients to register to use a system to book and cancel appointments online.
Well, being able to text was a massive help to me, and for the GP practice, because I was then being treated equally to other patients. I could text. I felt, hearing people can phone to make an appointment, I can text. That's equality.
Sensory loss champions are working across many departments to increase awareness and to support staff to make positive changes.
I'm a sensory loss champion, and what it means is I go to my colleagues and friends in the health board, and if I hear there's a promotion or event involving something to do with sensory loss, for instance Sensory Loss Awareness Month, or some sensory loss training that I feel that would be useful, then I'll tell them that this is happening. Also, if somebody's got a patient coming in with a particular sensory impairment that they need advice on, I'm happy to give my advice if I happen to know a bit about that information.
NHS Wales is asking patients with sensory loss to help us improve our communication with them.
It's really, really important for patients to tell us if they have any form of sensory loss. Clearly that condition may not always be obvious to a member of staff when they deal with that patient. So if they can give us that information, we can record it on our systems, and that message can get out to anybody who comes into contact with that patient.
I think it's very important that people like myself tell health professionals that I have a dual sensory loss, and to tell them what I need and to give them a chance to succeed.
I would encourage anyone with sensory loss to tell the doctors or nurses or any staff in the services how they would like to communicate, to ask for the information in their choice of format, and if they're not receiving either of these things, to then share their concern.
I'm supporting the It Makes Sense campaign to make sure that people with sensory loss have equal access to GP and health services.